The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm Don McIntosh, your host, and today we're joined with Dr. Philip Mills from Wichita, Kansas. Welcome, Doctor. I understand that you are a physiatrist. What exactly does that mean?
A physiatrist is someone who is a specialist in physical medicine and rehabilitation, and we take care of such problems as head injuries, which we'll be talking about today, stroke, spinal cord problems, as well as musculoskeletal problems and pain problems.
Okay, so you take care of a lot of things, but probably the most important thing is our head, and I guess we entitled this Protecting Your Most Valuable Asset, this segment. Why is the head so valuable?
Well, if you look at physiology, everything in the body is designed around the head. For example, the skull gives it protection. The legs give it mobility. The stomach gives it nutrition. And everything is designed to give information or some help to the brain. My eyes give it information. My ears give it information. And then the mouth gives it communication to the outside world.
So we're just walking brains.
Well, you might say that. And the neurophysiologists certainly believe that. But if you look at humans through the centuries, you find that the society of the time always used the highest technology to illustrate the brain. For example, in the Roman era, the highest technology of the time was the aqueducts. And so they compared the brain to an aqueduct. The brain has aqueducts. We call them various names, Aqueduct of Sylvius, so that comparison still comes down to this day. In the early 1900s, the highest technology of the time was the telephone relay station, and so they compared the brain to a very super television switchboard. I mean, a telephone switchboard. Then if you have today, the highest technology appears to be the computer. And so oftentimes people compare the brain to a computer.
I think a Macintosh computer. I mean, my name is Macintosh.
That would be the good comparison. Actually, the brain isn't a telephone switchboard, but it does have some switchboard functions. It's not a computer, although it does have some computer functions. Most people have no idea, but just to move the arm like this, it requires not only the biceps, for example, to bring my arm and flex my elbow as I'm doing here, but it also requires not only the biceps tightening, but also the triceps, the opposite muscle, and some other muscles to tighten as well, and so that you have this very smooth function because the cerebellum and the computer portion of the brain is figuring out where everything is, how tight it needs to be, and the movements that can be made in a fluid, coordinated fashion.
Must be fascinating to study about the brain and then figure out what's going on with, someone as they come in and they're injured. It's probably, not always easy, but what are the types of things that we do to damage the brain? How is it that people are injured?
Well, the brain is quite well protected. But even with the protection that God gave it with the skull, it can be damaged in several ways. For example, in ancient times, people would fall from horses. Today, with our high-speed society, with motorcycles, with automobiles, all-terrain vehicles. All these give us many, many ways to injure the brain, as well as the warfare that is done. That also exposes the brain to great risk.
Anything else that in everyday experience that damages the brain? I mean, the thing that comes to my mind, football.
The sports that people engage in, when I was growing up, we played sports. I had no idea of the danger that sports could have. Football is one, boxing is another that can cause brain injury. The biggest activity that threatens the brain that people do, of course, is the use of alcohol.
Any other injuries that you see to the brain that you treat? You've talked about, I guess you'd call them blunt trauma injuries. Anything else?
Well, let me just divide up the ways the brain is injured. We have blunt trauma, and that is generally where the head hits something. We're in an automobile accident and the head might hit the windshield at high speed. Or if you're in a motorcycle and the head hits the concrete at high speed. That is called a blunt trauma. You not only have the injury right there at the site of the trauma, but interestingly enough, since the brain is the consistency of Jell-O, the brain will jiggle. And so you hit let's say you hit your head against the dashboard. The brain, like this Jell-O, smashes up against the skull.
Okay.
And then it bounces back and hits the other side of the skull. This is called a contra-coup injury. And the contra-coup injury can also be quite substantial.
So the rebound place.
Yes, and then you have the twisting types of motion, the torsion types of motion that can tear little blood vessels, and so there's bleeding inside. And in fact, we now understand that the original injury is generally not the worst type of injury to the brain. It's the injuries that occur after the original injury because of swelling and other types of problems. Now, a second kind of injury is the penetrating wound injury, where you're shot in the head. And, or we had a patient with, that had been in a jail. And apparently he had made some fellow inmates very angry, and so they took an awl and they hammered it through his brain and then moved it back and forth. We call that pithing, P-I-T-H-I-N-G, pithing the brain, like some experiments in biology, they pith the frog, the spinal cord.
How did that guy do? That doesn't sound like something you'd want done.
That is not something that you would like to
man.
have happen to you. And he actually didn't survive. But sometimes they do survive those types of injuries. And if they can survive in a penetrating wound injury, if they can survive the original injury, oftentimes those types of injuries may be less damaging because they're very specific areas that they damage. In a gunshot wound, for example, maybe less than a more global kind of injury. The worst kinds of head injuries that you can get actually are those that involve loss of oxygen, because they encompass the entire brain, every cell.
I see.
And so that can be a real problem with carbon monoxide poisoning, those sorts of insults to the brain.
What's the first thing that needs to be done if you've had a severe head injury? What happens first? What should happen?
Immediately, of course, you need medical attention. The types of things that the brain does for the body, easily, automatically, you don't think about, breathing and the heart rate, all these types of automatic activities may be lost. And so the person needs to be immediately in a hospital that is skilled in taking care of people with acute brain injuries. And it takes, you think about this, what God built into our brains takes many, many skilled professionals to do for the person. He may not be able to breathe, so that you have to have artificial support systems. He's not able to empty his bladder, and so that has to be dealt with. And so you have this whole team that is working to save his life, and this, our little brain that God made, is working all automatically, doing those functions for us, and we don't even think about the loss of it.
So when the brain gets hit, then you've got what you talked about, that coup and that counter coup. What happens? Does it swell up inside? What goes on?
The first problem that has to be dealt with by the neurosurgeon and acute trauma team is that swelling. And because the brain is solid, there's no give to it, this swelling has no place to go except there's a large hole at the very bottom of the brain. And it's called, interestingly enough, large hole. Foramen, hole, magnum, large. And so the problem is it begins to squish the brain tissue down through that hole.
I see.
Now, at the very bottom of your brain, that is your life support system. That's your breathing. That's your blood pressure, some of the mechanisms. There's just a lot of mechanisms there on these vegetative levels. And because of that, you're at risk of dying if something immediately isn't done. And so this has to be monitored. Surgery may need to be done. They actually relieve the pressure if possible, and they give various medications to relieve the pressure, and that's all on an emergent basis. Now, I would like to say something about these vegetative functions here at the very base of the brain. It's fortunate that's where those vegetative functions are, because they get the first supply of oxygen, the first supply of blood as it comes out of the heart there at the base of the brain. And this area of the brain, the forebrain, gets the very last part of this blood as it goes through the head. If these vegetative functions were here in the forebrain, then if a person smoked, if a person used alcohol and all, it would
Kill them.
It would kill them immediately, but they still get enough oxygen and supplies because they're located here at the base that a person can still function.
So God created it in a way that protects us if we did happen to get injured. It's interesting.
Yes.
Well, when a person then, that brain is swollen and different things, I'm sure it takes quite a bit of time for that swelling to go down. How long does it take for it to go down?
Well, it depends. It may take even several weeks, or it may, depending on how severe it is, it may go down more rapidly. But really, at that point, as a person becomes stabilized, then a whole different type of treatment needs to be instituted, and that's really my area of specialty.
This is fascinating. When we come back, we want to talk more about this area of specialty. If you're watching, just joining us, we're talking about head injuries. We're talking about what happens when someone has a head injury, what needs to be done, how to relate to those who have had head injuries. And when we come back, we hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge. So call or write today.
Welcome back. We've been talking with Dr. Phil Mills from Wichita, Kansas. He's a specialist in rehab medicine or physical medicine, dealing with those that have had strokes and brain injuries of any kind. Today we're talking about head injuries, and is there any hope for those that have had head injuries? What happens when they start to recover from a head injury?
Well, the head injury has a certain way of healing, at least typically a way of healing. After you've stabilized them in the intensive care and they are able to breathe again and they're able to have automatic functions return, then you transfer them at an appropriate time to a rehabilitation center, and we give them intensive rehabilitation. Now, there are certain steps in the recovery that we look for. The first step is the agitation phase. And the person begins to thrash around, and they're rolling and moving their arms. And we look very closely at this stage because a person can't maybe talk to us, but we see that every aspect of their body is moving. Their arms are moving, each leg is moving, and that's a good sign. And if you get the agitation phase, the earlier you get it, the better it is. Sometimes we'll watch and they'll be agitated, but they'll only move one side.
Bad sign, huh?
Well, it's not a bad sign, but it means that they may have a problem on one side, a hemiparesis. We may find that they move their arms but not their legs, and then we have to look and see if they've also sustained a spinal cord injury. So we look at that, but if they're moving all extremities, we're relatively happy. Now, they may not at this point have any memory of what's going on, usually would not, but early recovery is beginning to occur. Then as we have further healing and the swelling is decreasing and brain function is beginning to be restored, they may have windows of memory.
Let me go back to that thrashing thing for a minute. What do you do? I mean, I suppose if I had a family member and someone was going through that right now in my family, I would be very worried if they were thrashing around. What do? Tie them up? Do you talk to the family? What happens there?
Well, we used to tie them up, but you don't tie them up. Today we have many better ways to treat them. Sometimes we used to give them medication to sedate them, but we found there are better ways. And in a good rehab center, what you do is you place them in a safe place so that they can move around and not be injured. There are special beds. In fact, before we had some of the beds we have now, we would simply put a big mattress that would cover the entire room floor, and then they could move around, and it was safe. They wouldn't be harming themselves. They would not be harming someone else. So you want them to be able to move. Now, they don't know exactly what's going on. They're confused. They're not sure what the lights mean and who these people are around them. And so we can understand their confusion. But then they will have windows of recognition. And it's very important for family members to understand some of the stages of head injury.
So you talk with them and you explain it all to them.
Well, let me give you a sample. The wife may be present, and you'll ask the patient what his name is.
Okay.
And the patient will give you their name, and then you'll say, "Who is that? Is there anybody next to you?" And they'll look, and they'll see maybe there is somebody. And so then you say, "Who is that?" And they may be alert enough to know they should know, but they're not certain who it is, or they can't get the name out. And they may have a problem we call perseveration. That is, once a thought has gone through their brain, it just keeps going over and over in their brain. And so they just said their name, so they say their name for their wife's name. And so that just keeps coming out for 2 or 3 times. Now, oftentimes a wife or a mother can't understand why the husband is not able to say who she is.
Can't recognize
And she may think that he's just joking. He may think that he doesn't realize this is an important question. And so, or they may be just quite offended. And so it's very important for the family members to understand these are just part of the healing process. The patient isn't trying not to say the name, but at that point may not be capable of it. And so with the rehabilitation program, you begin to show them pictures of family members and try to bring the memory of past events and important people, important dates, back into their focus. Try to repeat today's date until finally they know where they are, who they are, and what the date is. And so there's various techniques that we gently try to move the patients through these various stages of brain recovery.
Can you do too much for someone that's coming out of a head injury?
Yes. And so once again, the family members need to work closely with the team, and the team will let the family members know what should or should not be done to assist the patient.
I noticed when you gave the example, you said that the wife is there and the husband had the head injury. Who has the most head injuries, males or females?
Yes, it's a sexist type of disease. Actually, virtually 90% of males will have a head injury sometime in their life. Now, it might be a minor injury, but anytime a person loses consciousness, they've had a head injury. So I don't know if you've had a head injury. Have you ever lost consciousness?
I don't know if I want to admit to that.
But
well, I think you mean just losing consciousness.
Yeah, being knocked out.
Being knocked out is having a head injury.
Yes.
Well, I believe I've had one then, yes.
Yeah, and she would be with the vast majority of males. Now, you ask a group of women.
Have you had?
Yes, I've had actually quite a severe head injury. And I was amnesic for 3 hours, and that was a result of a bicycle accident. And that was when I was about 10 years old. But if you ask this question to a group of females, there'll just be a few that'll have had head injuries. So it is not because males have softer skulls. Okay. It is because they take greater risks.
What other behaviors are pretty typical of someone that's had a head injury? I guess a part of that question is, are there some things we should give people that have had a head injury a break concerning? In other words, they act a certain way because this happened. And I'm not talking about just getting knocked out once or having a bicycle injury. I'm talking about a significant head injury.
No, I think you ought to give me a break. And if I have problems with remembering, it's not my fault. It's just this head injury.
That's what I mean. I'm trying to get to that point. You know, some people would blame everything on this, but what really is the problem? Can we hold them accountable for certain things with a head injury?
Well, we have to see the flow of the improvement. They go through these various stages, and now you're asking long term. Most people with head injuries have very little sequela. And I used to hate to take care of...
What's sequela?
Sequela, long-term, real substantial deficits. It's a very small percentage of head injuries that have large deficits. And I used to be very depressed taking care of head-injured patients until I had a chance to see these patients 1, 2, 3, 4 years out and see how well they did returning to their occupations many times. And so now some of these patients are the most rewarding patients that you have. But typically the long-term effects of a head injury are a magnification of the underlying personality. If they were quiet, maybe they're more quiet. If they were boisterous, maybe they're more boisterous. So that it tends to magnify the problem. But one area that is very, very common, they tend to be irritable. And so we can understand this. It's easy to explain. If I'm overtired, if I am trying to do too many things, it's not difficult for me to be irritable. I have to fight irritability. Now, that's not because of the remote mild injury that I had. That's just the way human nature is. But in a head injury, if it takes everything they can just to do their day-to-day tasks, now you have loud sounds and you have many other things. it is as if they're handling a little extra stress like we would handle a great deal of stress. And so we have to understand there's a certain measure of patience that we should give a person like this.
This is fascinating. Any other behaviors that we would look for in someone that has had a head injury?
There's something very interesting. If you watch a patient, particularly the males, as they begin to become aware of their surroundings, very low level of function, they may be quite sexually inappropriate. And what that has taught me is it doesn't take much brain function to be sexually inappropriate.
So it's low brain function.
And so the highest activity of the brain is not at that level. And as they actually get more brain function, that area begins to diminish.
Hopefully they get over that fairly soon. But let's move from the low brain function and talk more about a high brain function. How could we avoid having a head injury? What types of things do you see? What kind of things should we avoid?
Well, our lifestyle, particularly recreationally, is a problem. Motorcycles, as we mentioned, boxing, football, these are dangerous, and bicycles are particularly dangerous for young people, children I'm talking about. And a person should not do any of these activities without wearing helmets. If I would have had a helmet on when I was riding my bicycle, I would not have sustained a head injury. So I am very much in favor of helmets and helmet laws for motorcycles.
Anything underlying those? Any other behaviors?
Yes. The single most important risk in head injury is alcohol. Sometimes I will be talking to a patient, and I'll ask them how much they drink, and they will say, well, I drink socially. There is no such thing as social drinking. Drinking is an antisocial behavior. Now, if you want to avoid head injury, don't drink and drive. Some of the more recent studies have shown that you shouldn't drink and ride a boat. There are other studies that show you shouldn't drink and walk. In other words, don't drink and drink.
What's the percentage of head injuries that are related to alcohol?
80%. 80% of the injuries to the head are caused by alcohol.
80%. So that's a very significant, it underlies everything, it looks like. Thank you so much for joining us, Dr. Mills, taking time out of your very busy practice and away from your family. We're thankful that you've joined us today on Health for a Lifetime, and we hope that as a result of today's program, you'll be involved in behaviors that protect your most valuable asset. And thanks again for joining us for Health for a Lifetime.